In October 2019, South Cumbria Services transferred over from Cumbria Partnership. It was a difficult journey to get to that point in terms of October. There were a number of hurdles to overcome, and the staff in South Cumbria were remarkable in terms of their resilience. They had to contend with a number of issues of were they coming, were they not coming, but they did on the 1st of October. That transaction in terms of a process worked incredibly well. However, we do know that there are a number of lessons that we've learnt from that transaction for about how we respond to people's inquiries and the staff. We issued all new IT equipment, and hopefully that was really welcomed in terms of having new laptops and computers, etc., to work on, new phones, new mobiles. But there was also a number of new systems that they had to learn, such as our Datix system, our e-roster system, and that's taken some time to get used to. But it's absolutely acknowledged that they have got used to it and they are using those systems now, which is great. We had inherited a number of issues that we needed to resolve, so we've had a post-transaction integration plan that has been working through. A number of those actions are about estates, so a lot of work is now starting on our inpatient facilities in Dover and Ramsey at Barrow, upgrading those wards to make them more environmentally friendly for the patients and also better for our staff to work in.
COVID-19 has been a real challenge for all NHS services, particularly the scare and the fright of working in a hospital environment where the risk of infection is high. We've done fantastically as a team. We've only had 3 team members who've tested positive, and a couple have had to self-isolate for the 14 days, but we've done very well, really. We've adhered to the PPE and we've used the gowns, the gloves, the visors, extremely hot, especially when the weather's hot. We mask up, so we do everything to protect ourselves and protect our patients. We had a mantra that actually it was digital first. So in South Cumbria we've seen a really good use of Attend Anywhere across South Cumbria, but where necessary, where face-to-face was required, the use of PPE, they have really responded to that use to protect themselves and to protect our patients. We normally, as part of my role in liaison, attend A&E when a patient presents in A&E with a mental health illness, normally suicide or self-harm or the mentally unwell. So rather than doing that and putting ourselves at risk and the patients at risk, we developed a room down here at Danegarth where we could bring them safely and assess them in a special room. It's called the Marac room. We've stripped it of the carpets, we've had 2 chairs put in, 2 plastic chairs that can be wiped down, and a plastic chair, comfortable chair for the patients, so we've kept the social distancing. So that room's been very useful. The team still work basically as we did before COVID, so actually the COVID, yes, it has its limitations, but it's not really affected patient care. We are a brilliant team. We respond very quickly to referrals that come in. We always make contact with that patient, either by telephone prior to being able to see them, to arrange to see them within the timescale that's set so we don't breach. We work very collaboratively with all other departments, so we engage with community mental health teams, first step providers, counselling services. So we've got a whole broad area that we cover, to make sure people are followed on in a safe way.
We are a very small team. There's 6 members of staff. We've got 3 nurses, an assistant practitioner and some admin support. And we work with the families of children with learning disabilities and/or autism from the ages of 0 to 18. As well as spending time with families on an individual basis, an awful lot of our work is based around groups. So we invite families to a range of different group-based interventions. That could be sensory workshops, sleep workshops, or we've got longer programmes on understanding the nature of your child's needs, or why they might exhibit certain behaviours, and understanding those behaviours in order to best support them. We have created a service that offers a raft of programmes, and that's so that parents can access them at times when it makes the most sense to them and their child and their family, depending on their context. So although it's early intervention and some people might think that's when a child's very young, it could be when they're very young, but it also might be when it makes the most sense for that family. So it might be at the age of 12 or 13, or it might be at the age of 2 or 3. One of the things we've been able to develop over the last couple of years is working much more with parents with lived experience to actually support the delivery of the groups. So we have some families, family carers, who actually co-deliver with us some of the programmes, and that makes a real difference to the relationship with the families that attend the programmes. They trust those family carers. They know that they've got that lived experience.
For Lucy, having a good day is generally a day where she is feeling calm and relaxed and isn't feeling anxious and upset, really. I don't mean that she's laughing and joking all the time, but she's just in a place where she can interact with her world, interact with me, she can explore a little bit and generally just feel calm really.
Last year we put ourselves forward for the learning disability category of the Nursing Times National Awards, and we were successful in actually getting the award. An incredibly exciting evening. What was so affirming really was that the judges said that their expert by experience, who was part of the judging panel, said that if this service had been available when he was a young child, that he felt it would have greatly enhanced his experience as a child.
Previously, I travel around a lot. I travel the whole of South Cumbria, so for between appointments, I make a lot of traveling. But with this video link appointments, now I feel like I got more time for the patients and carers and the staff and everyone, so that the traveling time has reduced considerably. So in that way, that's good. But also with the virus situation, there are a lot of crisis appointments, because a lot of our clients are getting more anxious, agitated, and a lot of challenging behavior and things. So we have to deal with them, and I have to review them more frequently than I used to do. So in that way, that was useful.
We are a team that consists of around 22 members of staff. We have nurses, occupational therapists, support workers, psychiatrists, assistant practitioners, admin staff, and we work primarily with people with dementia, work with older people with a functional diagnosis as well, so depression, anxiety, psychosis, where they're kind of very frail and elderly as well. We work for people right from diagnosis right throughout their journey, so we'll see people in the very early stages of dementia, assess, diagnose, commence on treatment, and then we'll put some support in place, work on kind of how to maintain their well-being and what's going to support them in terms of their functioning with their diagnosis. The well-being of our patients and carers is really important to us, so we try and, as well as all the clinical work that we do, we try and involve ourselves in community activities. So we play a key part in, for example, the Walney Dementia Action Alliance, which is around raising awareness for people with dementia and help them to live more independently in the community. We organise a yearly Christmas party for them, which is growing year on year. Recently as well, for Carers Week, we sent out carers packs which contain some little treats, but it contained pictures of rainbows that the staff's children had drawn, because obviously we're through the coronavirus pandemic, as well as practical information about caring for people during the pandemic.
I'm incredibly hopeful in terms of the future, moving to the Bay locality and responding to that ICP. I want to look at what is good in South Cumbria and what is good in Lancaster and Morecambe, and that synergy of bringing them together will mean that we've got an excellent platform going forward for our service users and the provision of mental health services across the Bay. Our staff are brilliant. They've been incredibly resilient over the last 11 months, dealing with change, dealing with COVID. I'm sure there's some change fatigue in there somewhere, but they're not showing it. They are responding excellently to the needs of our service users and ensuring that we are delivering the services. I'm incredibly proud of our staff.